Hello everyone. Today we will learn the technique of arthroscopic Bankart repair and Remplissage. This is the view from the posterior portal of the shoulder, and here we can see a big Bankart lesion with around 10% bone loss. So now we'll shift our scope through the anterior portal. Now we are putting a preloaded anchor in the Hill-Sachs lesion of the humerus head. After this, we take a bird beak and pierce it through the posterior capsule and infraspinatus muscle. Our aim is to pull out all the 4 threads from 4 different points, and for that we have to do multiple piercing in the posterior capsule and infraspinatus. Now we leave all these 4 threads as such and make a new posterior portal for viewing and further go on for our Bankart repair. Now we make one more anterior portal because we need 2 anterior portals for working. So now we are using a rasp to clear out the anterior part of glenoid and separate out all the tissue. So we have to lift the labrum so that we can bring it back for the repair. We are using a grasper now to see if the labrum can be lifted for the repair. Now we use a lasso tool to take the bite through the labrum from its most inferior part around 6 o'clock. So we pass the thread now and now pull out the other end of the thread also. Now we have to pass a knotless suture anchor. So we have to first place a drill guide on the glenoid and drill a hole. Now we are passing a knotless suture anchor. We have to simultaneously tighten the thread and cut it flush at the glenoid. Now we take another bite through the labrum at around 3 o'clock position, and now we are pulling out the thread and the other end also. Now we place another drill guide and pass the suture anchor with simultaneous tightening of the thread to pull out the maximum part of the tissue as possible. Now we pass another lasso through the anterior-superior part of the glenoid and similarly pass the thread, and we have to then fix the suture anchor at the 12 o'clock position. And cut it flush at the glenoid. This completes our anterior Bankart repair, and we can see that the entire tissue has created a bump in front of the humerus head. We can see a very beautifully repaired capsulolabrum complex in front of the humerus head. Now for the remplissage, we just have to pass 2 sliding knots from the 4 threads on the posterior aspect, and we can see how the head is moving in posterior direction. This completes our Bankart repair and remplissage. Thank you for watching.